We went hungry a lot, and I mean, my husband and I wouldn't eat because we were afraid the kids wouldn't have enough to eat, and he would catch jobs wherever he could, but without a full-time job, it's just, there's no way to make it. Even on just one income, there's almost no way to make it in this city.
I've seen people have altercations. I've had family experience abuse, sexual abuse, domestic violence. So there were struggles. We had a supportive network, but there were many issues that we had to overcome as a family.
I want to be a good mom to my son. I don't know, I started to get so depressed. I'm like, Mom, how am I gonna do this? It's so complicated. I don't know what to do. I felt so lost. I felt like I didn't want to go anywhere. I started to cry that moment. I'm like, my mom's like, no, you could do this.
Christy, Ashley, and Lucia illustrate some of the problems that families face in Mercer County, home to more than 81,000 children. New Jersey has the fourth highest cost of living in the country, and 17% of Mercer County children live below the federal poverty line.
We are in a county that has one of the most affluent communities in the nation. And to have children being born with low birth weight, to have children not succeeding in schools, to have children that are hungry and that are not given the opportunity to succeed, I don't know what else is compelling. I think it's a call to action for all of us to come together and out of our silos to work together to make sure we give every child the opportunity to thrive.
There's a pipeline for our community's children, and it is leaking. It begins before birth, when a quarter of this community's mothers don't receive early prenatal care. Our infant mortality rate puts us 19th among the state's 21 counties. Our juvenile arrest rate is the 5th highest in the state.
Here in the city of Trenton, we have a number of nonprofits who do outstanding work. The battle most times is that they don't have the resources to expand their bandwidth. The use and collaboration, partnerships with groups such as yours, Princeton Area Community Foundation, gives those organizations that additional bandwidth to supply additional resources to our community to help us reduce and fight poverty here in our city.
Princeton Mayor Liz Lempert agrees.
And it's shocking that any child in this country and in this county, and especially in a town like Princeton, would be going to bed hungry at night and having to wake up and go to school and take a test or to try to learn when all they can think about is the pain in their stomach. And in a place like Princeton, that was just unacceptable for this community, a community that has so much, that we would have kids in our community that were struggling to find something to eat.
Jeffrey Vega is president and CEO of the Princeton Area Community Foundation. The foundation's Greater Mercer Grants has a new focus on children and adolescents from birth to age 24 living in poverty.
Poverty isn't only an absence of money. Certainly financial capital is a powerful tool, but human capital is powerful as well, meaning developing educational assets. So being able to get a high school diploma, being able to get a college diploma.
As a senior at Hightstown High School, Lucia Kinde dreamed of attending Penn State. That dream was put on hold when she became pregnant at 17, something she hid from her parents until her 7th month.
I was talking to the baby dad. I'm like, are you gonna talk to my parents or what? Because I don't know how many months I was. I didn't know the gender. I don't know how I was a baby. I don't know. And he's like, no, I don't care about the baby. He's not my baby. He's not. I'm like, okay, fine. You can do whatever you want. I'm like, I don't need you. And that day, I told my mom, it was a night. I told my mom, I'm like, Mom, I'm pregnant. I don't know how many months I am. I don't know if the baby's fine.
She went to the doctor and found out she was going to have a healthy baby boy. Lucia's father was angry at first, but now is very supportive. He works 2 full-time jobs to help support Lucia and her son, and is contributing to her college payments. Today, Lucia juggles a full-time customer service job and pursues a nursing degree at Mercer County Community College. 3-year-old son Jose is in daycare with the same teacher his mother had.
Being a mother is the best thing seeing my son growing up and he's saying, "Mommy, I love you," is the most wonderful. That's why I'm proud to be a single mom, and having my son on my side is the most wonderful thing.
Parenthood is a powerful motivator. Ashley Brown and her 3 siblings experienced that firsthand. Their mother, a fierce proponent of education, had her first child at 15. She raised them in Trenton's North and West wards.
My father passed away when I was 18 months old. At the time, it was the 80s, which was a really rough time for this area in general. And several of my aunts and uncles they went through substance abuse problems. And at some point I was exposed to that.
Ashley's mother pushed her to succeed at school.
My mother was also adamant that her children would go to college. She did not go to college herself. She finished high school with her GED, and she wanted more for her children. So there were really no other options after high school than to go to college. She knew that education was pretty much the only way we would be able to get out of our current situation. I used to read a lot when I was a child, and to read, it kind of took you away from your current state, and it showed you that there was a life in a world outside of what you see in these 7 square miles.
Ashley was a good student and received a scholarship to Seton Hall, but the transition to college wasn't easy.
Coming from an area where there's like a 50% graduation rate, and it's mainly minorities in the community, to go into a place where it's a community of high achievers, children of diplomats, children of lawyers and doctors and things like that. And it kind of puts you in an imposter syndrome phase where you feel like, do I belong here with these people? And you know you have the grades, you know that you have the capability, and you know you work hard, but sometimes you second guess yourself. Do I deserve to be here? Or am I supposed to be back where all these other people that grew up like me are right now?
Ashley overcame her insecurities and went on to get a master's degree, the first woman on her mother's side to do so. She now works both as a Merck scientist and an adjunct college professor, and is a mentor for children, an important role affirms Yvette Martinez, a pediatric nurse practitioner in Trenton.
I think they need to be empowered. A lot of these kids don't believe in themselves because they've learned that from their parents. And poverty is a vicious cycle that kids I've learned here learn at home.
Grandma, today, my teacher, I had won a prize.
Brenda Holt is trying to make sure her children and grandchildren get the education and sustenance they need to succeed.
I raise multiple kids. I have 2 children of my own. I have exactly 7 foster kids. I have 2 adopted kids. I have a total of 22 grandchildren. And that's what they call me, Grandma. We don't use step, we don't use foster, we don't use adopted. I'm just their grandmother.
Brenda not only picks kids up at school, she also takes them to the soup kitchen to make sure they'll have enough to eat.
When I come here, I usually grab books and make sure all the kids have books, especially if you have parents that don't have transportation.
At the soup kitchen, Brenda sometimes sees Christy Us, her husband, and the couple's 2 young daughters. The family gets food stamps, but it is often not enough.
Both kids are growing, they both eat a lot, and it just doesn't last as long as it should. The past 2 Christmases, if it wasn't for the soup kitchen, the kids wouldn't have had a Christmas because we couldn't afford to buy presents.
To reach the whole child, we need more access to health care throughout the Mercer County region.
When the hospital was right in town, there wasn't that much of a barrier. People could just walk to the hospital. Now that's virtually impossible with it on the other side of Route 1, and we wanted to make sure that move wasn't going to get in the way of people getting the health care that they need. The hospital is now providing taxi service to residents who live within a certain distance of the old hospital, and they can call when they make their appointment. to meet with their doctor. They can also set up a taxi ride to the hospital. And we also worked with Princeton University. Princeton University has a free bus line called Tiger Transit. One of the lines goes out to Plainsboro. And they agreed to extend that line further into town so that it comes to Nassau Street, and that's a free service. People can take that, and it goes all the way to the hospital.
We run a kids wellness program here in Ewing Township where anyone under a certain income level can come free of charge to have their child examined, get their booster shots.
At a Trenton clinic, the staff know just getting children in for a visit is a big accomplishment.
Limited access to care affects kids from the most basic things to, do you have 3 meals a day, to, do you have your asthma medicine filled for this month? So it really affects how they come in here, in what conditions they come in. I have kids who are malnourished in Trenton, so I have to find ways to make sure that they have to eat, or they have the right vitamins that they need and the right medicines.
The Princeton Area Community Foundation is working on new ways to help children thrive in Mercer County.
All of the money that we put out into the community every year, that in itself is not going to move the needle on child poverty by itself. So the new way that we're going to have to operate is continue to do the grant making that we do, but we're going to have to leverage it. We're going to have to ask other funding sources to come alongside.
Collaboration needs to happen between every nonprofit that's out there.
When we talk about challenging problems such as poverty, no one entity can tackle that alone. So I believe in collaborations. I've spoken with a number of the mayors here to talk about opportunities, and we're not there yet, but talk about opportunities where we can combine resources, strategies, best practices for these issues. We all don't have them on the same level. Trenton has concentrated poverty that some of my neighboring mayors don't have to this level, but it's not unique to just us. So we're putting our heads together to figure out how do we do it in common cause, because what happens in Trenton impacts the rest of our county.
I think it's helpful to think of our work together as creating a success pipeline for all of our children. Right now, unfortunately, the pipeline contains many leaks. Research has shown if you tackle the impact of poverty at a very young age, you can increase the chance of children thriving and being successful. Plugging the leaks in the pipeline is much harder in later years. That pipeline needs to be reinforced and leaks plugged so we don't lose any children along the way. This is why the Princeton Area Community Foundation is focusing 75% of the Greater Mercer grants to addressing the issue of children and adolescents living in poverty. In a community with as many financial and intellectual resources as ours, there is no reason why we can't make a positive difference in the lives of our children. If we are thoughtful and strategic, if we're determined, if we're in this battle for the long haul, if we work together, we will give our children a better chance for success. Our children, and they do belong to all of us, deserve no less.